From CareCredit, it's Care Experts, a podcast where we dive deep into the health and wellness industry with the professionals that make it happen. I'm Erin Treloar. Cataracts are a common part of aging, but blurry vision doesn't have to be. Thanks to premium intraocular lenses, or IOLs, cataract surgery may not be just about restoring sight, it's a chance to upgrade it. In this episode, we're chatting with Dr. Dagny Zhu, a Harvard-trained, board-certified ophthalmologist specializing in cataract, cornea, and refractive surgeries, and medical director of Envision Eye Centers in Rowland Heights, California. Dr. Zhu walks us through how premium IOLs can correct common vision issues like astigmatism and presbyopia, and how this procedure may help you see life more clearly, often without glasses. Hello, Dr. Zhu, and welcome to the Care Experts podcast.
Oh, thank you so much for having me.
We're going to talk all about cataract surgery today and intraocular lenses. To kick things off, what even is an intraocular lens and why would somebody need them?
Oh, okay. So an intraocular lens, or IOL, is exactly what it sounds like. It's an artificial lens that goes inside the eye, and typically it's used to replace someone's natural lens that they're born with but is no longer working very well anymore, possibly just due to aging or development of cataracts.
Would you say that intraocular lenses, or IOLs, are generally used when individuals have cataracts, or are there any other reasons why somebody might consider them?
That's a great question. So most commonly, cataract surgery is where we use IOLs most often because obviously when we're removing that cataract, we can't leave the patient without a lens. They wouldn't be able to see anything. So we have to replace it with an IOL to restore vision. Okay. Now, there are times where we will remove a patient's natural lens, not because of a cataract, but simply because the patient has a high prescription or because they've lost their ability to read up close, usually due to aging, and that's called presbyopia. And so there are now more instances where we're performing IOL procedures earlier in younger patients before they develop cataracts for reasons such as not wanting to wear their glasses anymore, especially reading glasses, for wanting to obtain a full range of vision without having to wait for the development of cataracts.
Before we dive into a little bit more about the actual procedure around IOLs, from my understanding, there's a standard IOL, and now we have these premium IOLs that are available. Can you tell us a little bit about the difference between those two?
Sure. So when we're talking about cataract surgery, typically standard cataract surgery that's reimbursed by insurance, we're going to use a standard or basic IOL. And that's just what we've had for the longest period of time. It was the first type of IOL to be developed, and it's a very basic design, meaning there's only one focal point, which is why it's called a monofocal IOL. And typically we set that focal point for distance. Okay. So patients after cataract surgery who receive the basic monofocal IOL, they're going to be able to see far away, drive, watch TV without glasses. But for any focal points or activities where they have to do it a little bit more up close, like arm's length for the computer, or really close here, like for reading or seeing their cell phone, they're going to have to use glasses for those activities.
Okay. So then the premium IOLs, what are they bringing to the table?
So the premium IOL is for patients who want to reduce their spectacle independence across that full range of vision. They're like, I don't want to wear computer glasses. I don't want to wear reading glasses. So then these are typically multifocal lenses in which you get multiple focal points. And so you'll see far, arm's length for computer, up close for reading, without having to use glasses for the most part. And there are other types of premium lenses which give you a little bit less full range of vision. They're called extended depth of focus lenses. Those are for patients who value mostly the distance and intermediate or computer range. And then up close, they can see things if they're not too small, like text messages. Any fine print or fine reading for a long period of time, they'll just still have to wear reading glasses. But the quality of vision can be better at distance and at nighttime compared to a full range multifocal lens. So that's why some people might choose this extended depth of focus IOL instead of a regular multifocal IOL. Okay. And then the final category of a premium IOL is the toric lens. And those are also typically not reimbursed by insurance. And they don't give you the full range of vision, but they are correcting astigmatism for patients who have it so that you can still see far without glasses. If you're not correcting the astigmatism with a toric lens, then you may still have to wear glasses even to see far away.
If somebody's considering IOLs, how would they determine which option is going to be best for them?
So that's going to be a conversation that the patient has with their eye care provider. And so assuming that their eye exam is completely normal and they would be a candidate for a premium IOL, which is a requisite for a premium IOL. You've got to have healthy eyes with no disease in order for these premium IOLs to work well and to give you the best quality vision. And so your eye doctor is going to determine that with you. And then you, based on your habits, lifestyles, are going to decide whether a premium IOL upgrade is worth it for you or not. There are some patients who spend their time on the computer almost all day, or their whole world is right here, 16 inches. They're just on their phones reading, and wearing glasses is a nuisance to them. Or they're in some sort of occupation where they literally cannot wear reading glasses because they're in construction, they're doing carpentry, it's falling off their faces all day, right? Those are the patients I think are the ones who would really value that full range of vision and maybe more likely to want to upgrade to a premium IOL.
What does the procedure of inserting an IOL look like? What's that experience like for the patient?
Yeah, so the entire procedure is going to be composed of two parts. The first part is actually removing the natural lens, and the second part is inserting the new IOL. And whether you're doing cataract surgery or a lens exchange surgery because you just want better vision when you're over 45, the procedures are pretty similar. Typically with a basic or monofocal lens, insurance is not going to cover the use of a laser. And so those are done in a standard or basic fashion with the use of a blade, usually to make the incisions, without a laser. If a patient chooses to upgrade to a premium IOL, that's when the laser comes to play. Typically it's paired with a laser just to increase the precision of the outcome a little bit more. And so in those cases, a laser does some of the first steps of the surgery by making the incisions without a blade, by creating that what we call a capsulotomy, which is a hole in the capsule that's holding the natural lens so that it's perfectly circular and centered. Typically that would be done manually, but if with the laser, it's all done in less than a second. With the laser, it's a little bit more precise. And it allows, when the lens is inserted, it allows the lens to be positioned more centrally over the patient's visual axis, allows for greater long-term stability, hopefully better vision. That's why we tend to combine the laser with the premium IOL just to hit those levels of precision a little bit better than you can get with manual surgery. But in terms of the portion where you're inserting the IOL, it's the same based on whether it's a basic monofocal IOL or a premium IOL. It's folded into a tiny cartridge, either manually or sometimes it comes preloaded. And so it can fit into a very small incision, less than 3 millimeters. And then we gently just push it into the eye. It's delivered into the eye, into the capsule where your original lens was sitting. And it gradually unfolds on its own. And it has little haptics on the sides of the lens so that it stabilizes itself and centers itself within the bag. And so that's it. It's pretty much like a 10-second procedure, that portion of the surgery.
Wow. Would you say that doing that surgery with the laser is safer than doing it manually, or is the risk factor about the same?
It's a complex question. There's been a lot of research to show whether it's truly safer, what advantages does the laser provide over manual surgery. Overall, they haven't been able to find too much of a difference, but I would say if you look specifically at those premium lenses where even a little bit of decentration can affect your vision outcome compared to a monofocal lens, I think if you're looking in that category, that's when you'll sort of see the advantage of a laser. And there's certain conditions where absolutely the laser is going to make it safer than if you were to perform it manually. Certain types of cataracts, which are a little bit more complex and difficult to remove, the laser actually assists with softening those dense cataracts. So there are definitely certain types of cataracts where there has been evidence showing that the laser does provide a greater level of safety and precision.
given that these IOLs are generally a solution for somebody with cataracts, can we just back up for a moment? Can you explain what a cataract is and tell us a little bit about removing the cataract?
So I think a lot of people aren't quite sure exactly what a cataract
Yeah.
is. And it is simply your natural lens that has aged and no longer functions the way it used to. So when we're all born, we're born with this clear crystalline lens inside the eye that can focus and zoom in and zoom out, help you see the full range of vision. After the age of 45, we already see these age-related changes where the lens is not so clear anymore. It's a little bit yellow, it's a little bit hardened. And one of the first effects of that is that we lose our reading vision. So that's actually a sign of us developing early cataracts. You can't even call it a cataract at that point. It's so mild that it's almost like an early baby cataract, right? And as the years go by, that lens starts to harden even further. It starts to get even cloudier. And at some point, it gets to the level where you just can't see well anymore, regardless of whether you're wearing glasses or not. The light can't penetrate through that cloudy opacity. And so that's when it's known as a cataract. It's affecting your vision, where you can technically no longer read the 20/20 line with glasses or contact lenses. And at nighttime, some of the earliest symptoms are just seeing halos or glare around car lights, not feeling comfortable driving at night because you just can't see as well. So even though your daytime vision may still be 20/20 with glasses, those nighttime symptoms are sometimes the first signs that you're developing a cataract. And so it's at that point where it's affecting your day-to-day functioning, your overall visual quality, that it's called a cataract and typically would need surgery to remove or replace.
Okay, so when you're removing a cataract, are you removing that whole lens or are you cleaning the lens?
In both cases, whether you're removing the cataract manually or laser assisted, ultimately what you're doing is sectioning out those fragments of the cataract that you're breaking up into small pieces with a small device that has ultrasound energy. So during surgery, we're inserting this ultrasound handpiece that fragments the cataract into small pieces and at the same time has a vacuum, so it aspirates those pieces out until there's nothing left. What the laser adds is a pre-softening step. So it actually fragments the lens so it's easier for us to manually remove those pieces later on and potentially reduces the amount of energy that we need to use and can reduce swelling and inflammation, things like that.
It's so fascinating thinking about this teeny tiny area that you are working on, and yet once it's resolved, it makes such an insane difference for people in their lives.
Yeah, I mean, if you think about it, the lens is a crucial part of our eye and what contributes to vision. There's so many different structures in the eye. Honestly, if you have an abnormality in any of those pathways, your vision's going to be affected. But imagine having a lens that's no longer clear. How is the light going to get through and process in your brain to develop that image that we're used to seeing and calling sight or vision? So you've got to get rid of that cloudy film. It's like having a camera where the lens is
I was going to say, it's like, how
damaged or
annoyed do I
cloudy.
feel when my camera lens on my phone is foggy? Imagine having that in your eye
That's
or
exactly what it
impacting your
is.
sight. Yeah. Okay, amazing. Now, if somebody's considering this, what do they need to know before going in for the procedure? And how long does the treatment actually take?
So once you've been determined to be a good candidate for a premium IOL procedure, typically it's similar to refractive surgery or LASIK, where we're going to have you treat your eye with artificial tears, lubricants, to make sure that any dryness is properly treated ahead of time, because that can affect the measurements that we take, and it can also affect how you heal after surgery. So some patients after IOL surgery, they feel a lot of irritation, a lot of difficulty during the healing period, and that's because their dryness was not properly treated ahead of time. So drops are the name of the game, especially those dry eye drops ahead of time, and we often give wipes for the eyelids too, because we know that eyelashes and the eyelids contribute to the health of the eye itself, and if those parts are not clean, they've got debris on them, bacteria, the oil glands in your eyelids are clogged, those healthy oils aren't coming out and coating the surface of your eye, lubricating. And so that can contribute to diseases that lead to dry eye, but also swelling and itchy of the eyelids that again affect and delay your healing process. So often I'll just have my patients do eyelid scrubs, warm compresses, and artificial tears every 1 or 2 hours before surgery to get them ready.
Okay.
And then when they come in for surgery itself, we put numbing eye drops to get them ready and so that they don't feel pain during the surgery. We put dilating drops because the pupils have to be enlarged for us to be able to access the cataract. And we give them usually a pill to relax, similar to LASIK,
Yes.
where patients are more comfortable. You don't have to use as much medication to sedate them. And because the procedure is so quick, I would say overall 15 minutes or less per eye. If you are doing the laser portion, that portion's a minute or less beforehand.
So fast.
Overall, very quick. So my practice focuses on, the patient experience. And so we do as much as possible as needed to keep the patient calm and comfortable and just get them, kind of in and out safely and comfortably.
Amazing. And after somebody's had this procedure, how long does it last for? Is this a lifelong result that they're going to receive?
So the results should definitely be for a lifetime.
Okay.
And unlike a natural lens or a cataract, which is constantly aging and worsening year after year, an IOL is artificial. It's not going to change anymore. So typically, once we put the IOL in, we've selected the proper power. That patient, as long as they don't cause any other issues to their eyes over the years, that vision's going to be maintained. Now, the only thing that may happen, and is very common, is sometimes we have to do a little cleaning behind the lens, and it's called a posterior capsule opacification. Sometimes little cells from the cataract that are left over, they proliferate on the back side of the IOL and form a membrane. So that can diminish the vision, usually a few months or even years after surgery. But if we see that, we do a really quick 10-minute in-office procedure and just get rid of that membrane, and that's it. The vision really should maintain. So as long as you keep your eyes healthy, diet, exercise, you should be able to enjoy that vision for life.
Amazing. I have a couple of questions from our audience for our Ask Me Anything portion of the conversation. The first one is, I'm getting cataract surgery next month with premium IOLs. Will I get back to my 20/20 vision after the surgery?
So the goal is always to get you the best vision possible. I hate promising 20/20. Every patient's 20/20 is a little bit different. Some patients naturally have greater potential than other patients. Everyone's eye is a little bit different. But obviously, yes, the goal is always to get you the best vision possible. Now, the question is 20/20 at what focal point, right? So if you want if you're just opting for a monofocal lens, my goal is just to get you 20/20 at distance, but that's not going to be true at intermediate or near. You're going to have to wear glasses to see clear at those distances. But if we're putting a premium IOL in, then absolutely, we're trying our best to get you the best vision possible, far, intermediate, and near. Now, I would say in the beginning, you're going to have some healing to go through. So it's normal to see a little bit blurry that first day or even that first week. I would say overall by 1 month, most patients are pretty good, but it can take up to 3 months usually to stabilize, some patients even longer. Now, one thing I didn't mention before is that there is one side effect with premium IOLs.
Okay.
And because these are multifocal lenses, they have rings on the IOL to reflect light to focus at different points. Now, one side effect of that is at night, when you're driving and you look at the headlights of other cars, those rings are going to reflect the lights of those headlights. And you're actually going to see halos or rings around headlights of cars when you're driving at night in the beginning. And that's totally normal. I tell all my premium IOL patients with the multifocal lens to expect that. And it's generally going to reduce in time as the brain adapts as the eye is healing. And for most patients, it ultimately becomes something that they notice, but doesn't bother them very much, and they're still able to drive very well. But that is one difference between a multifocal premium IOL and an extended depth of focus IOL and a monofocal IOL. The extended depth of focus IOL has fewer rings, so not as many halos and glare at night, so much better for patients who prefer to drive a lot at night with minimal visual disturbances. And then the monofocal, you have the least amount of those nighttime glare or ring issues at night, but at the consequence of having to wear reading glasses. So it's all about, give and take and what the patient values the most.
Incredible. I get nervous thinking about someone doing surgery on my eyes. How long is the surgery and how safe is IOL surgery?
Well, in terms of safety, cataract surgery has been around for decades. It is the most commonly performed surgical procedure every day around the world. And so we have a really long track record for IOLs. Patients always ask me, is my body going to reject the IOL, right? Is there a
Right.
chance, right? It's a
Yeah.
foreign object. But the position of the lens in the eye is in a safe space. And we do have decades of research showing that these IOLs, for the most part, stay very safe and inert in the eye. And in terms of how long the procedure takes, it's really quick. In office, you may be there for a couple hours, but most of that is preparation as we're getting your eyes ready for surgery. As I mentioned, we're going to be dilating the eyes, and before the surgery, we're going to clean the eyes very well with an antiseptic to prevent any infection. And then we put a sterile drape over the eye to make sure no other part of the body is contaminating it. And we're going to keep the eye open with a little eyelid speculum or holder, similar to LASIK, so that you're not going to be able to blink and you don't have to worry about that. And it's going to keep your eye open the whole time so that I can do my job. So in and out from when I'm actually entering your eye to exiting, it's probably 10 minutes or so. So the actual procedure itself is super quick. Most of it comes down to the preparation, like most things with surgery.
I'm 65 and wear glasses, and I just found out I have a cataract in one eye. Can I still get premium IOLs in both eyes, even if only one needs surgery right now?
Oh, what a great question. And this is something that comes up not infrequently. So when most patients present for cataract surgery, it's for both eyes, because in general, what's going on in one eye is happening in the other. But it's not always the case. There are some cases where it really is just a cataract in one eye. And in those cases, it's going to depend on how your other eye is doing. So if your other eye is seeing perfectly well, you're not really wearing glasses for that eye because there's really no major prescription either, then it makes perfect sense to just focus on your cataract eye and treat that. And then after surgery, you should be able to see well in both eyes, hopefully without the need for glasses if you do a premium IOL. Now, if the other eye has a high prescription and you're already wearing glasses, that's when it becomes tricky, because if I only operate on the eye with the cataract and I get that prescription to 0, you're still going to be left with the other eye that has a prescription. And if you try to wear glasses for one eye with a high prescription, one eye with no prescription, most patients feel very unbalanced because the lens is going to be different thicknesses, which is going to distort the world and the size of shapes in one eye compared to the other. So typically in those cases, especially if there's signs of an early cataract, we'll recommend getting both eyes done, and we can correct the prescription in that eye so that both eyes are more similar and balanced. And so you can hopefully go free without any glasses in either eye, or wearing glasses with similar prescriptions in both eyes if that's what the patient decides is more comfortable for them.
Amazing. Thank you so much for sharing your incredible depth of wisdom and knowledge with us today. It's been wonderful having you on the show.
Thank you so much for having me. It was a pleasure.
Hey there, don't leave yet. Just wanted to say, if you want to hear more about health and wellness, check out these episodes of Care Experts. Also, before you go, make sure you like and subscribe. New episodes drop every Wednesday.